Know you know that when a 6'6" big black guy walks into the office and he needs a tooth extracted, you start to sweat a little bit. Why? Because the bone density in the different races of humans are different. Hi, my name is Dr. Elom. Everything I do to challenge the status quo. I believe in approaching life differently. The way I challenge the status quo is by creating environments in my life to enrich original thought, creativity, and abundance. I just happen to be a dentist. The questions that I'm answering for you today are from your comments from Instagram, TikTok, and YouTube, in addition to the patients that I see every day. So keep asking them. I could talk about dentistry all day.
Dr. Elom, what is the difference in bone density amongst races?
This is a funny one, especially for my fellow dentists out there. I know you know that when a 6'6" big black guy walks into the office and he needs a tooth extracted, you start to sweat a little bit. Why? Because the bone density in the different races of humans are different. Traditionally, African Americans have the most dense bone. Why is this important? Because if you need a tooth out and you go to a dentist that does extractions but doesn't necessarily like doing them, they're going to have a tougher time working with you rather than someone who's white or Mexican or any other race. Now, I don't have the statistics behind it. I'm sure there's a study out there. I'll try and put it in the comments. But generally speaking, if you black, you got strong bone. And if you need your tooth pulled out, you better make sure that dentist knows what they're doing because it can be so challenging. I remember pulling out my brother's wisdom teeth. And if he's watching, I want him to know that that was one of the hardest extractions I ever did in my life because he's just like me. 6'4", big black man, healthy, strong. His wisdom teeth did not want to come out. But we did a good job for him. But I just want him to know that it was one of the most challenging experiences of my life. And so I hope that helps you have a little bit more compassion for your fellow humans when it comes to dental work and understanding the inner workings of how dentists think.
Hey, Doc, what causes bad breath?
Bad breath can be caused by a few things specifically. First off, brush your teeth. Brush your teeth when you wake up in the morning, brush your teeth when you go to sleep at night. That helps. The second thing, and hoping a lot of people are starting to get the hang of this, but get a tongue scraper. You'll be surprised how much gunk builds up on the tongue over the course of a day. Imagine going a week without scraping your tongue. Click the link down below. I'll put a few of my favorite tongue scrapers down there. That way you get one that really helps you tackle it. Now, a couple of other things that people don't realize that may cause bad breath is, let's say your wisdom tooth is partially erupted. What does that mean? That means it's poking out of the gums, but there's still a little bit of gum over it, so you can't really see the whole tooth. Why is that important? Because a lot of times food can get stuck in and under the gums and cause bad breath. Now, imagine you ate a hamburger on Saturday and 2 weeks later, you still have a little bit of that hamburger stuck underneath your gums and that wisdom tooth. It's going to smell a little bit. So my advice to patients who are in this situation, and my advice to patients everywhere, actually, if you're watching this, go get yourself a water pick. Pro tip, mix a little bit of mouthwash in there, half that with a little bit of water. The antimicrobial agents from the mouthwash can get in and around the teeth to where the floss can't even always get to all the time. So it's important to use that little tip. That way you're able to stay fresh all the time. Now, the last thing I want to talk about that a lot of people don't realize that may cause bad breath are tonsil stones. Now, I know that I didn't get my tonsils out when I was a kid, and there was a time that I had tonsil stones. And tonsil stones are very insidious in that you can't really see them, but you can smell them. So if you want to, I think a good tip is to go see your doctor to see if you need your tonsils out. Otherwise, you can use your water pick to try and get back there and try and squirt them out in such a way. But talk to your dentist. That way you can get a full examination to see if you do have tonsil stones. And another reason why you might have bad breath is just simple gingivitis. Sometimes the gums can get red and they won't be strong enough to adhere to the teeth. And then bacteria can get stuck in between the teeth and around the gums. And after that, it's slippery slope to bad breath. So, if you want to figure out why your breath is not doing so well, try these out before anything else and see if that helps.